Good communication skills are important for the care team because it makes sure that everybody has a voice and that everybody has an input in the care for the client.
The good communication is very important to the care team because everyone providing care to the patients has to be on the same page.
What happens if you don't communicate with a provider what you've been doing with the patient? Then it may be duplicated, or they may feel like you're not doing, the correct things in order to get this patient to their health. So the provider should always be informed about what's going on. There's also other care teams within the clinic, different social workers who may be dealing with the patient's mental health. They also need to know what you're doing and what's going on with them. It's all benefits the patient. So in the end, it's, you're not duplicating services and you're not doing anything that may be harmful to the patient.
Key elements for good communication with the care team is making sure that everybody has a voice, also by showing respect for everybody's opinion within the care team.
A key element is having a safe environment. It's for anybody to voice their opinion, whether it be the patient navigator, the care coordinator, the provider, the PSA, and especially the patient, They need to feel that they can have their opinion heard and something's gonna either be done about it or, be addressed in a professional manner, whether it's, I feel like I'm not being heard with the provider and the care coordinator addressing that with the provider. And whatever it is that the patient, in the end, it's all about the patient and having them feel safe and welcomed.
It's important for each to have a clear understanding of each other's roles so that, one, they do not step over each other of what they need to do. Two, the responsibility would not fall into one individual. Everyone share similar responsibility to provide a good care to the patients.
A clear team role is important because there are overlaps in what we do. And sometimes the overlap do not cause any problem, it's okay. But we do need to know what is expected of one to do and how do they follow, because that's how I'm going to judge what is the end of that and how do I get to the end point.
To help with the team communication, we have a set schedule for a daily huddle in the morning with the medical provider. This is to run through who are the patients, what is going on with those patients for that very day. We meet with the care coordinator to go over what's going on that day, who are scheduled to come in. Did the patients confirm the appointment? If not, what happened? What do we need to do? And sometimes things happen, patients might get incarcerated or a patient might be hospitalized, and those something that we update. We also have a weekly multidisciplinary meeting, and those are not collaboratively between medical provider, mental health provider, and other service provider, which are care coordinator and a patient navigator.
The most important thing to support good team communication is to make sure that your scheduling situation is correct, to make sure that your clients know when you are available to meet with them and to be able to handle any needs that they may have.
Some of the tools that we've developed are weekly schedules. A lot of times we may have conflicting schedules. There's only a certain amount of us in the office. And so with weekly schedules, we make sure that a week before we have planned out the week to know, okay, who's gonna be in the office, who's not gonna be here. So there's no conflicts. And obviously the care coordinator reads this before the week starts to know, okay, no, this needs to change and this needs to change. And it allows us to always have someone in the office to see a patient who may walk in. And it allows for, a better flow. Another thing we do is face-to-face, and that is where we write down our patient list and we write down who we saw for the day. And I may see someone else's patients, so I also write them down on my list. So there's tracks in our program which are involved monthly, weekly. This allows us to know, okay, this patient was seen, whether it was by me or someone else. So these are great tools for us that we have that helps the care coordinator keep track of what's going on with the team.